Hello.
Hi.
Sorry, we have a very bad storm and we had some technical difficulty, but I think right now we're all together.
Yes, we are. And as long as
Yes,
you're safe, that's what's most important.
we are good. And we're gonna share the screen and I'm gonna introduce Dr. Selim Benbadis, who is here.
Hello.
Hello.
Hi. I'm just going to go over some announcements quickly first, if that's okay.
Of course, go
Okay,
ahead.
great. So good evening, everyone. Welcome back to Tea Time with an Epilepsy Specialist. We're really excited to have you tonight, and thank you all for being patient with us. My name is Rachel Stevens. I'll be your host for this evening. I'd like to remind you all that tonight's session is being recorded and will be reposted on our social media platforms.
You'll be with your computer and share.
Okay. Now, if you love our tea time sessions, you definitely want to check out our second annual Seizure Smart Symposium. It's going to take place on November 7th at 1 p.m. And we will be partnering with several medical experts presenting on topics ranging from memory to genetics to choosing the right seizure medication for you. Please follow our social media pages so you can stay up to date with that. And here's a quick slide on some of our presenters that we'll be having at our symposium. We hope to see you there too. Okay, before we get into the question and answer session, I'd like to remind you guys how to ask a question. So please keep yourselves muted. You can ask a question by using the raise your hand feature. You can see what that looks like here in the graphic. I know it depends on if you're using a computer or a cell phone. So if you do have trouble finding it, it's okay. You can also submit your question in the chat box. I'll be monitoring the chat box as well as my co-host Jessie. Okay, and last but not least, a huge thank you to our sponsor this evening, which is Greenwich Biosciences. We are so grateful for your sponsorship. And with that, I would like to introduce to you Robin Abruzzese from Greenwich.
Hi, everyone. I just want to say a couple of words about myself and about the company. And then Dr. Kettani, if you want, I can introduce you and Dr. Benbadis, or you're more than welcome to. So whatever you would prefer.
No, go ahead.
Yeah,
Go ahead.
you
Okay.
do it so well.
Please do.
I'll say only nice things, I promise. It's good to see everyone. Hi, my name's Robin. So it's nice to meet all of you. I'm honored to be speaking with you virtually today on behalf of Greenwich Biosciences. We're a sponsor today, obviously, of Tea Time, and Greenwich Biosciences is proud to partner with the Epilepsy Florida for events like this to help people stay connected in this virtual environment. I know that it's difficult, today to try to connect with people over this platform. So we're really happy to be able to be here to support you all through this. We're united in what we're trying to accomplish here today to raise epilepsy awareness and to have a positive effect on care, research, and the lives of those who are impacted by seizures. There are many families who wake up every day to the reality of epilepsy, and we know that. There are people listening to this right now who have been fighting against it their entire lives. And there are others who are not able to join us today. But as a community, we never give up hope that one day we'll overcome the challenges of living with this disease. This is what drives us to do what we do. You may know us best as the company researching and delivering FDA-approved cannabinoid medicines to help address serious conditions, but also know that our focus is on you all. Patients and families are at the center of everything that we do, and we strive to make positive and meaningful differences in our lives. Today and every day, we're proud to be here with you, virtually and in real life, to raise awareness, to take action, and to continue the fight against epilepsy. So thank you for allowing us to be a part of this event and a part of all of your lives. So I'll introduce Dr. Kettani and Dr. Benbadis. They're going to be your speakers for today, and they're very fluent and able to answer any of your questions. So I'm sure that they will say that they would love to have them and have this be an open forum. But Dr. Kettani is board certified in both neurology and epilepsy by the American Board of Psychiatry and Neurology, practicing at Advent Health in Tampa now. She's a member of the American Academy of Neurology and a member of the American Epilepsy Society. She's currently an active board member of Epilepsy Florida. She focuses much of her efforts on improving the patient experience and providing care for underserved populations. And then the special guest speaker is going to be Dr. Benbadis. He's a division director of epilepsy, EEG, and sleep medicine at the University of South Florida and Tampa Hospital. He's professor, Department of Neurology, Epilepsy, EEG, and Sleep Medicine at the University of South Florida. So they're both very, very knowledgeable in epilepsy and obviously tonight's topic. So I hope that you all learned something and have a great time, but feel free to ask questions, and it's nice to meet everyone.
Great. Thank you so much, Robin. And now, Dr. Kettani, the floor is yours.
Hello, everyone. Once again, I'm very happy to see you all. And sorry again for the technical problems, but we live in Florida. We can't predict the weather. So welcome again. And Robin has already introduced my very dear friend, colleague, and great mentor, Selim Benbadis. And he will be here to talk about a very interesting, sensitive, and important subject. Medical role, what's the benefit, and you, after the talk, you will be able to ask any question about the topic or address all the questions we usually talk about, and free to share. So welcome, everyone. I'm going to let Dr. Benbadis talk about his presentation, but now I'll have to do a screen share.
You'll be fine.
So we're going to do screen share.
That's it.
Perfect.
Thank you, Hind, and thank you everyone for attending. I'm going to keep this fairly brief because I am well aware that the best part of this is the question and answer session. So I'll, first of all, I want to thank Epilepsy Alliance and Dr. Kettani for inviting me, literally inviting me because we are next to each other, not just virtually. And Robin for sponsoring this. As Robin said, she works with a company that manufactures the pharmaceutical CBD called Epidiolex. And so what I'm going to try to do is discuss with you briefly so-called medical marijuana, why it's important, and what the differences are between medical marijuana that you may get at a dispensary and a pharmaceutical specifically for epilepsy. This is to thank Robin. I didn't think it was going to be done before, so I'm glad you get thanked and acknowledged twice. You said Greenwich, I think, or Greenwich Life Science. They have different names. I think GW is the worldwide or Europe name of Greenwich, something like that. But it's the same company that manufactures Epidiolex. My disclosures is that I am a consultant for every pharmaceutical company that has an epilepsy product or device for that matter, including GW. I was a prescriber, and I believe Dr. Kettani was as well. Maybe you still are. I am not anymore. But I was for a couple of years. And then I subsequently served as medical director for one of the Florida dispensaries, and I am also no longer doing that. So as you know, this is a hot topic, right? Since it came on the scene about 6 years ago in Florida, there is all kinds of industry and all kinds of promotions and all kinds of claims about medical marijuana, and not all of them are true. I just put here a few screenshots, but if you look at advertisements, you see all kinds of claims about medical marijuana. All of this, as you may recall, started about 2013 or 2012 with Sanjay Gupta, who is a terrific medical correspondent for CNN, a neurosurgeon as a matter of fact, and did a story on weed or medical marijuana, and there was a part 1, and then there was a part 2 and a part 3, and he became very involved with Charlotte. You may have heard about Charlotte Figi, who had Dravet syndrome. And this is important because this is really why the medical marijuana for epilepsy, at least at the beginning, came about, and why Florida, like many other states, adopted a Compassionate Use Act, whereby we or patients could obtain compassionate use of medical marijuana for difficult seizures, even though there was no evidence at the time that it was effective. So this is Charlotte. She had a very severe type of epilepsy. You can see hundreds of seizures a day, etc. Dravet syndrome affects young children. They usually don't survive to adulthood very often, and she didn't. She actually passed away just a few months ago. And Sanjay Gupta talked about her very emotionally, in fact, on CNN. But this is where the impetus came to make medical marijuana available for difficult epilepsies. So what does medical marijuana mean? It doesn't really mean anything. That's why I put it in quote. It means that it's marijuana product or cannabis products prescribed or recommended by a healthcare professional. It's a very vague definition. if some healthcare provider says, I'm prescribing medical marijuana to help such and such symptoms, it becomes medical marijuana. It doesn't mean that there is good evidence for it. So there are two separate issues, and they are completely separate nowadays. There is what I call the compassionate use from 2014. That's the marijuana that people can get at dispensaries for all kinds of conditions, not very well regulated, as I will show you. And then since 2018, we have Epidiolex, and that is a medication like any other medication. That means it was reviewed by the FDA. The FDA looked at the evidence, decided it was safe and effective, and released it on the market. And it can be prescribed like any other seizure medication. So there are different types of cannabidiol or cannabinoids, if you will. Endocannabinoids are the ones that are in our body. Synthetic cannabinoids, like your name says, means that it's synthesized in the lab. And phytocannabinoid is the plant-derived cannabis from the plant marijuana. And that's what most of what we are talking about is. And as you can see here, the two most well understood and the two most abundant cannabinoids are THC and CBD. THC is the one that causes the psychological euphoria and therefore addictive properties. CBD is the one that Epidiolex is, and that is the medication for epilepsy. We understand as physicians that we can't cure everybody, and so there are many people with any kind of disease, not just epilepsy. You can talk about cancer, multiple sclerosis, Crohn's disease, who fail all the treatments we have. And when that happens, patients become desperate, and we, because we are compassionate, want to give them the opportunity to try treatments that are not proven. That's normal human nature, as long as those are safe. So there is always a need for compassionate products that haven't undergone all the trials. This is from our organization, our professional society, the American Academy of Neurology. And I show this because they publish guidelines periodically. This is who we answer to, if you will, the American Academy of Neurology. And in 2014, as you can see the date, they put epilepsy under the category that medical marijuana has no evidence that it helps. And in 2014, that was true. And I'm showing you this to show you that things change in our world. So it was true in 2014. In 2014, the AAN says there is no sufficient evidence to say that it works for epilepsy. That is not true anymore. It stopped being true in 2018. So things evolve. In science and in medicine, when you hear a fact in 2014 was correct, in 2018 it's not correct because we have done trials since, and now we have Epidiolex. So when we use compassionate products, meaning compassionate means that we don't know for sure that it works, but I have no other option for you for your disease. So we should try it because we want to try everything to make you better. That applies to epilepsy, neurology, and medicine in general. Every specialist has diseases that we can't cure. Cancer is a good example. So as long as the patient has tried regular treatments, if you will, standard treatments, we think it's okay to try unproven compassionate treatments as long as they are safe. For some of them, there is some evidence. For some of them, there is none. And so then it becomes a judgment call, again, as long as it is safe. This is the newer website of the Florida Department of Health. This used to be called the Office of Medical Marijuana Use. Actually, that is what it used to be called, the Office of Compassionate Use. Then it was called the Office of Medical Marijuana Use. And this is the Office of Medical Marijuana Use. And this is the website. It's called knowthefactsmmj.com. It is very well done. I recommend it highly because it's up to date. These things evolve all the time. For example, as of just a few weeks ago, edibles, medical marijuana became legal. That just happened. This website, the Florida Department of Health website, will have up-to-date information. We may not always know the latest. This will give you the latest. So I really recommend that you save that and consult it. It's helpful for physicians, it's helpful for patients, and it's helpful for caregivers. This is what it looks like. You can go there on your own, but you can see there is things for patients, for physicians, there is the law is in there, and all kinds of guidelines for physicians as well as patients and caregivers. General ideas for compassionate use in Florida, and they are the same in other states because people come more or less to the same conclusion. You have to have a certain diagnosis called qualifying conditions. I'll show you what they are. You have to be a Florida resident. You have to be over 18. For children, meaning less than 18, you need 2 physicians to prescribe, not just 1, but 2. As we said, patients should have tried conventional treatment. We don't want to offer unproven treatment, marijuana or otherwise. We don't want to offer unproven treatments if patients haven't tried the basics, okay? The ordering physician, us, must weigh the pros and cons. The cons is that we don't know everything about this. It's not a medicine. It hasn't been tested. The pros is you have no other option. We want to help you. So you have to weigh the pros and cons. There is a registry in the state of Florida where patients and physicians have to be registered, and they have to have a specific marijuana card. These are the qualifying conditions in the state of Florida. Everything started with epilepsy, by the way, because of, what's her name? Charlotte. But you see that now the qualifying conditions have expanded. Cancer, terminal illnesses, ALS, that's amyotrophic lateral sclerosis of, Lou Gehrig's disease. Multiple sclerosis, Parkinson's, glaucoma, HIV. You can see all the diseases. And the problem is, in red, they also say that medical conditions of the same kind or class or comparable. So that basically encompasses just about everything. And the bottom line is it is to the discretion of your physician and your medical marijuana provider to decide if your condition qualifies. It's become a little bit of the Wild West and a little bit subjective. Now let's focus on epilepsy. As I showed you, until 2018, we had very little data. We have Charlotte, but Charlotte is 1 patient. That's not data. We like to operate like scientists, even though some people, even in our government nowadays, claim that if 1 person does something, that's enough to say it works or doesn't work. We don't work like that. We work with science. We do clinical trials. So it starts with animals, then we do case reports, then there were subjective reports by parents, and finally in the last 3 years or so, we have some data that confirm what we thought, which is medical marijuana, or at least pure CBD, which is what Epidiolex is. Pure CBD does work to suppress seizures, and it works just as well as other seizure medications we use every day. Because we do trials for specific type of epilepsies, it was approved only for 2 types of epilepsies initially, called Lennox-Gastaut and Dravet. Those are childhood onset epilepsies. And in the last few months, it just became approved for another condition called tuberous sclerosis complex. And so now there are 3 types of diseases, if you will, epilepsy diseases for which Epidiolex is approved. You see the dose here. There is some monitoring to be done. I'll spare you the details. Remember, CBD is the non-euphoric, non-habit-forming part of marijuana. So it's not habit-forming. And as a result, Epidiolex, which was initially a scheduled substance, like opioids, for example, is no longer, because it's not habit-forming. So for us in the field of epilepsy, it's very reassuring that we now have data. We now do know something about CBD and epilepsy. It does work. It is not the miracle cure. It has side effects like every other medicine, but it is one of the things we can use for certain types of epilepsies. The problem with the CBD that people get at dispensaries as opposed to a medication is that you don't know exactly what you are getting. It's not regulated by the FDA. It is regulated by the state, and they do a decent job, but it's not as regulated as FDA approved medication. So for example, the proportion of THC and CBD is not always clear. The concentration, how many milligrams of CBD, how many milligrams of THC is the patient getting, is not always clear. The dosing is the complete Wild West. For epilepsy, we know the doses because, again, we did trials. So we can tell you what doses we think are effective. For other conditions, MS, Parkinson's, glaucoma, Crohn's disease, cancer, HIV, I have no idea. Of course, I'm a neurologist. I don't treat those. But the point is, we don't always know as much for other conditions as we do for epilepsy because they haven't done the trials. And of course, the cost, if you go to a dispensary, patients pay hundreds of dollars for just a few milligrams, which we know for epilepsy is not enough. And of course, because this is not a medication, this is not reimbursed by insurance and it's out of pocket. By contrast, the medication Epidiolex is an FDA-approved drug like any other medication. It's highly purified CBD. There is zero THC, which is why it's not a scheduled substance anymore. It's FDA regulated. It's consistently manufactured, one batch to the next, one pharmacy to the next. You get the same exact thing because it's regulated. And of course, it's federally legal. Remember that marijuana, cannabis is federally still illegal, but the states legalized it and the federal government isn't going to bother. We know that. So just to conclude, and then we'll open it for questions. People are passionate about medical marijuana. Oftentimes, like every passionate issue, the extremes are wrong. This is not the cure-all that will solve every problem. And it's also not completely useless and habit forming. Both of those are wrong. We should have an open mind. It works for some people. The data are increasing more and more. We will find out more. I showed you between 2014 2018, we learned that it works for certain types of epilepsy. In the next few years, we will learn how it works, at what dose, with what side effects in other conditions, other types of epilepsies, other neurologic diseases, and other conditions outside of neurology. So it's evolving all the time. We have to keep up to date, and so do you. Moderation is in order. By that, I mean, I dismiss both extremes as I do in politics. It's not the cure-all and it's not useless. It's somewhere in between. Research goes on all the time. We have trials for epilepsy. Other centers have trials. That's how we learn. The position of the Florida Department of Health is very reasonable, how they made it compassionate use for patients like Charlotte who run out of options. We think it might help. It's safe. That's what compassionate use is. And write down the website because it's well done. And most of your questions on medical marijuana in Florida will be answered at that website. Thank you very much. I hope I wasn't too long. 30 minutes. That's about as long as I usually. And now we're happy to answer questions or comments or criticisms.
Thank you. Our first question is from Julianne. You can unmute yourself.
Okay, I was gonna ask how you guys doing?
Good,
I
thank
was
you.
gonna ask, due to the fact that there's different seizures, can the medical marijuana control all of them, or just certain types?
That's a great question. Yes and no. It's only approved for 3 indications, as I said, because that's how we did the trials. But we think that it probably can help every type of seizure. It just hasn't undergone the testing, which means it's not FDA approved, which means insurance will probably not reimburse. Do we think it worked for other type of epilepsies? Yes, we do. Most of us do. But at this point, if it's not an indication by the FDA, it's likely that your insurance will not cover, and it's not, nobody can afford this. It's very, very expensive without insurance. But again, time will change that. I guarantee you in a couple of years, we will have trials showing that CBD works in other types of epilepsies, and then the indications will grow. But we usually start little.
Okay,
Great question.
Okay, sorry. You said that we can't afford it. How much does it cost?
Too much.
Okay.
Well, let me put it this way. When people get at the dispensary. Go ahead.
I can answer that question. I can. Because I asked my neurologist about it, he said it would cost about maybe $2,000.
Oh my God.
It depends on the dose. It depends on the dose.
Yeah. Well, yeah. Something like that. Yeah.
That is correct. And so people can afford it when they take very, very little that we think does nothing for seizures, like 20 milligrams a day. That does nothing. People can afford that. But if we put them at doses that we know from the trials work, which is hundreds of milligrams per day, then like you said, it'll be $1,000 or $2,000 per month. So it's not affordable.
So the average that the annual cost is $32,000.
This is Epidiolex or Epidiolex?
Epidiolex at
Oh, wow.
dose.
That's if you didn't have insurance. Everybody has some kind of.
Okay, thank you.
Great. Thank you for the question, Jillian. Our next question we have in the chat is from Sandra, and she says, what specifically are the side effects?
The side effects are very benign, and honestly, they are similar to other seizure medications, and they are There's nothing unsafe about this, but it's the typical fatigue, dizziness, sometimes GI problems like diarrhea. But they're very benign, and really in comparison to other seizure medications we use all the time, it is not worse. And oftentimes it depends on the dose, and oftentimes it depends what else the patient is taking. So we can mitigate that and adjust, but it's also dose related. The higher the dose, the more side effects. If you start low and you go slow, usually it's tolerated.
Why did it
Let's
say?
just say, sorry, Sandra. I just gonna say something again. Like we always, when we talk in our meeting, we go back to what is epilepsy. Is imbalance between excitation and inhibition. And all seizure medication, we want to increase the inhibition to balance the excitation. So by doing that, any seizure medication you'll take, it will cause drowsiness. So that's kind of the main side effect that is shared by all of them. The only couple things that are for Epidiolex is if you take some other medication, which apply to the rest of the other medications as well, but it can interact a little bit more with certain medication than some other seizure medication. But again, we have to take in fact that it's also indicated for some certain form of seizures that are very severe or certain syndrome that which is approved for. But again, as the discretion of the physician, we could prescribe them for certain type of seizures that are resistant to other medication. So anytime you increase and you use a medication that is specifically for certain type of severe medication, you will have to expect that the side effect will be a little bit more than what you would expect from the other ones. A little bit more drowsiness, that's why it's titrated, that's why the price, like Dr. Benbadis explained, will increase because we start at a low dose and you have to titrate. And most of medication, we try to titrate them because we want to keep the retention. It means the patient, the person who suffer from seizures, to take the medication for longer time and to get used to it. So we started very slow. So the side effect that is the main concern and really is the drowsiness. But to be avoided, we started at a low dose and we keep increasing it over time.
Like we do with all meds, start low and go slow. The other side effect is that it can affect the liver a little. So it is recommended that we check liver function before and every few months. To be fair, many other seizure medications also can increase your liver enzyme. So that's not all that unusual, but because it's a new medication, we monitor the liver function regularly.
And again, what's good about all these new medication is anytime they come to the market, there is way more strict criteria for them to be approved than the older medication. That's why, for example, for Epidiolex, you have to monitor the liver. And any other medication that will come in comparison will be so high and the requirement would be higher. So it doesn't mean because you have to do that, that's what it's going to do.
Dr. Kettani, you keep going in and out. I don't know if that's true for everybody else.
Just her, not me?
You don't, just Dr. Kettani.
Louder voice.
That is strange because we are
Literally
next to each
not
other.
social distancing at all.
Great. Thank you for that question, Sandra. And we have a question in the chat from Casey. Would you like to ask your question?
Hi, Casey.
Where is Casey?
Right here.
I see you.
Hi.
Hi.
I was wondering if you think it would be a good combination drug to go with,
Combination with what?
like with another seizure medication. You know how
Oh,
people are on multiple seizure medications?
yes, great question. As a matter of fact, it is used mostly in combination, simply because when it came on the market, first of all the trials were done with people who are already taking something. So yes, it works very well in combination for a couple of reasons. One is it's different from any other seizure medications we have. So it doesn't duplicate, it does the same thing. It's different from every other medication for epilepsy we have. So you can combine it with just about any other seizure medications. There are some interactions we know, in particular with two medicines, clobazam, also called Amphi, and valproate, also called Depakote. And with those, it has some specific interactions that we are aware of, so you have to be a little bit careful with the dosing. But yes, it can be combined with virtually any seizure medication, simply because it's different from all of them.
Yeah, I'm presently going to get my son an EEG, and I'm in California, so they won't approve the medication unless he has one of those
That's right.
seizure
Yeah.
disorders.
So that's why you have to do the EEG, and hopefully he meets the diagnostic, you know, one of those diagnoses, Lennox-Gastaut, Dravet, or tuberous sclerosis, and hopefully he qualifies.
Yeah, thank you.
Great, thank you for your question, Casey. Our next question is from Madeline, and she is asking, will insurance...
Rachel?
Yes?
I just want to add something else for Casey.
Okay.
What I wanted to say, Casey, there are sometimes on certain occasion you could get it approved even if that's not the indication that is FDA approved. Your physician may require to go a step ahead and make some pre-authorization if your son has failed couple drugs and his seizures are not controlled on couple medication he has tried, and you are moving to the next step. So even if it's not those two or three right now criteria that are FDA approved, your physician could do it if they do, again, extra efforts, and if your son has failed other medication.
Very good one. I knew you were useful to be right next to me.
Yes.
I forgot to say that. It's very true. And in fact, we have done it for people who don't have the right type of epilepsy, if you will. And like Dr. Kettani said, as long as the neurologist can document that he has tried A, B, C, and D, and it's very difficult to control. And I think it's been approved 100% of the time. But like Dr. Kettani said, they have to write a letter and explain all this, and they will approve it for what we call off-label use. Good point.
Do we know what the milligrams of this Epilex is, or I don't know?
Yes, we do.
Yeah,
Yes.
Of course.
it's like per bottle.
Provider of your son will decide to start the medication. He will start that is talked about earlier, because we want to avoid the side effects.
Yeah, you are cutting out.
How it's supposed to be prescribed.
And it's per weight, per body weight. That's how we decide.
Oh, okay. All right.
Can Dr. Kettani, can you repeat what you just said, because you came in and out? Hi, it's Shirley, Dr. Kettani.
That is very strange. Okay.
Yeah, you came in
what
and
I
out, so
said-
it was very difficult to get the complete thing, or if, I don't know why, maybe it's where the mic is located on your computer.
Yes, a male voice.
Is it better now?
Yes.
Maybe I'll be louder. I'll be just louder.
They would rather see you than me anyway. Go closer.
So what we said that there are a couple medications, anti-seizure medication, that will have specific indication in epilepsy, because that's what FDA has approved. But as a physician, we're not computer, we have to use our own judgment. So we use them on occasion as off-label. But when a physician uses a medication as off-label, they have to go through a painful process of calling the insurance, getting pre-approval, and speaking to a peer review and all that stuff. But if your family member or yourself need that medication and your physician is convinced that's the next step to go, they can get it approved. So that is one thing. And Casey asked about the dosage. And the answer was, in most of seizure medication, we start at low dose, and especially for Epidiolex, because it's the next step, we start at a very low dose, which is per kilogram, and we increase it every week till we reach the goal dose, and we maintain, or the maximum tolerated dose that the patient require and respond to and tolerate, and keep them on it. You hear me?
Yes.
Yes, thank you.
Thank
You
you.
just have to get closer.
Thank you. Okay, our next question is from Madeline. You can unmute yourself.
Where's Madeline?
You're having
Let's see
trouble?
Madeline. Or you can write it in the chat, and then
There she
Rachel can
is.
read
No,
it.
I think you just answered the question about the insurance question. So,
That's an important
Okay.
one.
yeah, no, I mean, because my other, Depakote and the Lamictal that I'm taking are covered, so I just don't know if that would be covered too. Yeah.
Okay. Thank you. So our next question is from Minerva. Would you like to ask your question, or I can ask the doctors for you? Okay, so she's asking, is it safe for a 5-month-old baby?
So it's approved down to the age of 1. It was 2 and recently became 1. So that means that if it's a 5-month-old baby, it would be off-label. And it's the same argument we just made with Dr. Kettani. If you would have to argue with the insurance, it's off-label, but he's tried everything, blah, blah, blah. Is it safe? Probably, but it's off-label and hasn't been tested as well as above the age of 1 or 2. So it's a little bit of unknown.
Okay, thank you.
Thank you for your question. We have another question in the chat. It says, do you think it works for heterotypic bands and can replace other medications? Also, can you take it to school?
3 questions there. Does it work for heterotopic bands? Yes, it works for focal or multifocal epilepsy, regardless of what the cause is. And heterotopic bands is just a congenital malformation. So yes. The second part was what?
Can you take it to school?
That was the third part. What was
The second part was, can it replace other medications?
Well, in theory, yes. In practice, very rarely. Usually you add it to something and you might be able to decrease the other ones. But in theory, yes, it can. And I've heard of it. I've never had a patient end up just on Epidiolex, but it's possible. Can you take it to school? That's a tricky one. If we're talking, well, this is when you differentiate between dispensary and Epidiolex. If it's Epidiolex, it's a medication. Yes, you can take it to school like you take the Depakote, the Lamictal, or the Keppra. If it's from a dispensary, it's a little trickier because the school could argue it's federally illegal. So that's going to be up to the school. That could be a little trickier. For the same reason, by the way, you can't take it to the hospital for the same reason. Most hospitals will not let people bring their own medical marijuana, but if it's Epidiolex, it's a prescribed medication, there's no problem.
Thank you. And so now the next question is from Ms. Lumpkin. Will it help with concentration and memory?
Well, I will say if it controls seizures, which interrupt your concentration, from that part, I will say yes, it will help because it helps control the seizure and it helps the seizure from progressing to becoming worse and using most of your nerves, your brain cells. But in itself, if it can be used as a medication to increase your focus, absolutely not, because it will cause you to be a bit drowsy. So it will not, it's not a medication that that focus on the receptors in the brain that cause excitation, which increase the focus in. It goes to the opposite area of the brain, which is the inhibition, which calms the brain. So logically, it cannot do it. And it's not prescribed for that.
And also remember, things change. There might be a trial for Alzheimer's disease next year. That's well done, double-blind, placebo-controlled. That might show, we just don't know. So right now, there is very little evidence or none, but this could change. That's why we do clinical trials.
It can potentially improve if somebody has issues of concentration because of interruption due to seizures or due to other conditions, maybe memory loss due to deposits on the vessels and the nerves, and maybe the endocannabinoid will slow down the progression. But like I explained, since it works in the place where the focus is generated, it cannot be used as an ADHD medication, for example.
Great, thank you. And Lori Michelle, you have a question for the doctors?
Well, I think she kind of answered a little bit, but it was more of a comment. I was just wondering if the medical marijuana kind of helps to subside the seizure triggers, certain triggers, thereby helping to prevent them. Like if stress is a trigger or something like that, is that kind of how it works, or Is it, but then you answered it earlier, I think, Dr. Kettani, because you said it actually travels to the other side of the brain than the other
Well,
things, which is releases inhibitor.
It's tough to answer, but for example, we think, again, the evidence isn't huge, but we think that CBD, and for that matter, THC, can help sleep. And sleep deprivation is a common trigger for seizures. So sure, if you improve somebody's sleep quality and quantity, it might help seizures, it might help cognition and memory. So possibly, but again, the evidence is minimum.
I would add something too. Again, there is like the two most component that we really have been studied, kind of. We know about the CBD and THC, but the medical cannabis have more than 100 of the CBDs. So what that we don't know about, but all what we know is the CBD work in certain receptors and stimulates the ones that we already naturally have, and the THC potentiates that CBD to work. But the problem in epilepsy, because epilepsy, if it's originating from your temporal lobe, which is most of the time, most common seizures are originating from the temporal lobe, if you give a lot of THC, that can decrease the seizure threshold and can cause to have seizures. There's a lot of musicians that you will hear about, they never had seizures when they stopped smoking, now they have seizures. Again, it's like a withdrawal. They were taking like a medication that was calming or getting that seizure threshold a little bit in shape or restoring a little bit that balance, and they were taking the right thing on the right time and so forth. And yes, again, if you have anxiety and you take more CBD than THC, because THC has psychological effects, you can control the anxiety, and by that you could decrease you being stressed from how that could be the trigger of your seizure, or the anxiety that doesn't allow you to focus, and now maybe you're focusing more. But then now we're talking about, you know, going multiple ways to get somewhere instead of going straight. Make sense?
Yeah, it does, absolutely, thank you.
Thank you. Our next question is from George. Would you like to unmute yourself?
Yeah, I was wondering, besides this medical marijuana, due to the pandemic we're all in, how much more time will it take for new medication to be released and given up for us to try? And that so we won't get held back and waste time.
There are several. It's always happening continuously. There are 2 or 3 medications that were released in the last 6 months. So it happens all the time. Now, it's not necessarily for the same type of epilepsy as Epidiolex, but I can think of 3 off the top of my head. Xcopri is one, fenfluramine is another one, and the stiripentol is approved here. But it's for babies. One of them is for babies. But it's happening all the time.
All the time?
There are at least two in the last 6 months to a year that were released on the US market.
2 released. Because like late last year, I had heard that during the spring of this year, cenobamate was going to be released. However,
that's one of them. It's one of them that I'm referring to. It is released. It's available.
It is? Okay. Okay.
Now you just need to get your neurologist to prescribe it if he wants you to try, or she wants you to try something new. It's available. It just became available literally a few weeks to a few months ago.
Okay. Thank you for letting me know. I'll try and push him and see.
Talk to him.
Thank you, George. And our next question is from Daisy. You can unmute yourself. Daisy?
Do you hear me?
Yes.
Oh, I just used to, I take the CBD oil, but they give me the side effect for migraine. And then it worked, yes, but and sometimes I get anxiety, and well, I suffer from migraine, and then taking in the CBD oil, it causes more migraine in the
Problem.
anxiety.
I'm surprised it causes more anxiety, but migraines, I don't know. But you know, every medication can have side effects, and those are very variable from patient to patient. So you have to weigh if is it helping enough the seizures that you can tolerate the migraine. That's a tough one.
I have a question for you. What CBD are you taking?
What CBD?
Sure.
Let me see.
It's from a
It's
dispensary.
I'm sorry, I take the thing off.
Or a CBD you got on your own?
Not a prescriber.
No, they prescribe me. I take that.
So this is the thing, Daisy. When you buy a medication that is not FDA regulated or FDA something, at least looked at it, they are not obligated to share with you the exact content of how that CBD is made or how much CBD really is on it or what is it mixed with. There must be some colorant or ingredient that are added to the oil, and these ones could cause allergy, can cause intoxication, they cause skin rash, and some of them, they could cause migraine because they're triggered for migraine. Some of them may cause you to have anxiety because you're suffering from pain now, and so forth. That's why it is very important to stick with something that is really studied and scientifically proven. Because when it's not regulated, anybody could claim anything, basically.
That's what we're discussing earlier. You don't really know what is in what you are taking, how much CBD and what else is in there. Pesticide, coloring,
like
THC.
that. And I don't sleep, but I don't, you know, I take it to sleep, but I try everything to able to help me to sleep. I take it for seizures, but they do help me for the seizures. But the first time I was very sick, like I used to be in the hospital for 5 days and having seizures every day. So the CBD oil, they do help. Only thing is I get the side effect for the migraine, and it causes what they call dizzying.
Every medication can have side effects. It's oftentimes it's a risk benefit or pros and cons.
Yeah, but I have an insurance, the Medicaid, Humana Medicaid. I don't know if it is covered for the CBD oil.
Well, not the oil, but the medication. But again, like Dr. Kettani was saying, you would have to have your neurologist argue and contact the insurance and explain that you've tried A, B, C, D, and you're desperate and that you deserve a trial of Epidiolex.
Okay.
Worth a try.
Thank you.
Great. Thank you. Thank you, Daisy. Our next question. Did you want to, I'm sorry, did you want to say something else?
No, I just said thank you.
Okay, great. Our next question is from Tier. They have 2 questions, so you can unmute yourself.
Hi, thank you so much. The first question is really straightforward. Just, do you know if Epidiolex affects thyroid levels? My daughter's thyroid levels have been pretty on par for several years now, and I just don't know if we should up our blood checks, if it's going to affect that at all. And then the second question, the Epidiolex started causing her severe panic attacks when she titrated up. She's never had panic attacks, no history of anxiety, like at all, which is why we definitely knew that that's what was causing it. Very debilitating panic attacks. The neurologist, like you already talked about, you have to weigh those pros and cons, wanted her to come kind of back down on the dosage, but then she started having seizures again. My daughter, who just turned 18, kind of made the executive decision. We've been trying to encourage, you know, some independence there. that she would rather have the panic attacks than the seizures. I don't know what how good of a decision that was, but that was, kind of what she can live with. Do you know if this side effect eventually goes away or if it becomes better tolerated, kind of like that initial fatigue side effect that shows up in the beginning?
Neither thyroid nor anxiety are known side effects, at least of CBD as we use it for epilepsy, but patients are different and we learn all the time. I have not heard that, and it's not known to be a side effect. Neither one of them is known to be a side effect.
Well, I'm gonna think in a completely different from probably a psychiatric view. Sometimes if patients have some depression and they are prescribed antidepressant, they can become psychotic. And why? Because they have underlying other issues. For example, they are bipolar and they're given a certain antidepressant, and that makes them in a good mood, and that trigger the other part that was hidden because it was covered by something else. So now she has panic attacks. Maybe she has something else that was going on, and now that she is more calm, it's triggering that, because the CBD technically it will work on your GABA receptor, which is like Xanax, for example, to calm your anxiety. So it's technically not supposed to do that unless there's something underlying, maybe to be addressed with a psychiatrist. That is just my view. As far as the thyroid, I am not aware of. And two, the tolerated maximal dose is different for everyone. That's why in most of the new medication, they stop doing the blood level because it means nothing really, unless the person is toxic or they're still breaking through seizure, and we want to figure out what dosage is best for them. So if she has responded to a certain dose, but it's not when she reached the maximum tolerated dose, maybe her physician could add something else combined to Epidiolex, may still give the full control of seizures instead of having to deal with anxiety, but in exchange to get the seizure control, because she will get the seizure control maybe if we add another medication, or if we manage the anxiety because she has some underlying psychiatric problem, mental health problem that could be addressed by the mental health professional. Do you agree?
Mm-hmm.
Can you just repeat that last sentence, Dr. Kettani?
So my suggestion is maybe there's two options. Either her provider could add another medication by to the Epidiolex, but lowering the dose to a tolerated dose that does not cause this panic attack. And at the same time, maybe she could see a mental health specialist to address maybe if there was some underlying mental health problems that wasn't addressed in the past and were masked by seizures and other things. And now that we have the seizure controlled, now we have the anxiety coming up. And most of the time, seizures have a lot of psychiatric comorbidities as well. And they could mask each other, or they come together, or exacerbate each other.
Okay, thank you.
Thank you, Tier, for your questions. We have time for just a couple more. We have one in the chat from Jesse asking about side effects. I know you've spoken a bit on that already, but in particular, they were asking if you have seen more weight gain or more weight loss.
I have seen neither with Epidiolex. And what about with a dispensary?
I haven't seen anything. I mean, maybe it was reported from two patients that was severely disabled, completely disabled on wheelchair. They're not able to communicate, but they are on other medication that are really heavy. So I can't speak for that if I can relate it to really Epidiolex, but that's the only time that was reported.
Yeah, it seems to be neutral for weight, which is good.
Great, thank you. Our next question is from Laura Howard. You can unmute yourself.
Hello, thanks for doing this this evening. I had a quick question in regards, hi guys, to bone density. Do you know if this affects bone density with long-term use like some of the other medications?
The ones that are really well known to affect the bone density is a very old seizure medication. Although because it's usually started at a very young age, and we still don't know much about the side effect that because it's just been really released and we don't have the very long-term experience on it. I cannot answer that question by certainty and say it will cause osteoporosis like the old ones that were determined really to cause osteoporosis if you are being taking them for a long time.
No, but I would agree. I would say probably not because it's not a strong enzyme inducer like phenytoin and phenobarb and carbamazepine and so forth. So we don't know for a fact. It hasn't been on the market long enough, but probably not. And if it does, it's not to the extent of the old medicines like Dr. Kettani said.
Thank you.
Thank you, Laura. And our last question is from Jillian. She's had her hand up for such a long time. Thank you for being patient. Jillian, you can ask your next question.
Okay, I should have asked this question earlier. This is about the edibles that you mentioned. Does that cost more and does it have the same kind of side effects?
God only knows.
So this is the thing with the edibles. The edibles, again, is not controlled or regulated. Is somebody cooking, and maybe there is, yes, a dispensary, there is certain form of regulations, but not strict. So if I tell you it has 10 milligrams of THC, it could be 20, it could be 5. So I don't know what you're getting and how sensitive are you to 5 versus to 20. If they say it doesn't have THC, it may have 2 because they cannot make it completely CBD or then it won't sell really well, honestly. Because everybody who buys the gummies that are medical cannabis is looking for a little bit of THC on them. So you have to be careful because again, nobody is really strictly watching how much is in it. And that's where it becomes dangerous if you have seizures because your brain is very sensitive to changes and you have to be very consistent. That's why as an epileptologist, we always ask patients to take their medication the same time every day to give the brain that same consistent dosage that is restoring that balance because the brain is tricky.
Okay.
But if you play with it, it will play with you too.
Okay. All right. Thank you so much.
Rachel,
Yes.
can I make a closing comment? Because you said that was the last question.
Absolutely.
I have a word of wisdom. You hear all kinds of claims for medical marijuana and for other things. There are people, pillow guys, who claim to have the cure for the coronavirus. People can claim anything, but that's not how we work in medicine. Just one person saying, I took this, I'm fine, therefore this is safe and effective. That's not how we work. There is only one way, and that's double-blind, placebo-controlled, done by honest people who look for the truth. People can claim all day long, don't believe everything you read. It takes time, and like I said before, things change. Sometimes there is no evidence for something now, maybe in 3 years there will be. Don't believe everything you hear or read or claims by individual people based on 1 or 2 people.
And again, I agree to what Dr. Benbadis just said. And if the medical cannabis has been approved by the states and not federally, is because there is concern that there is those tricky dosing and all that. It has some useful use when you are terminal cancer. It can, if you have, I would rather give medical cannabis than opioid for chronic pain. But again, it has to be you and your physician decided which is the dispensary they trust the most, what is the dosage you're looking for. But again, if you have epilepsy and you can control it by medication or proven medication, stick to those.
Thank you so much.
But that wasn't my closing statement. My closing statement again is I didn't hear Tina today. I don't know what, she didn't say anything because she always give us a word of wisdom. Hi, Tina.
I don't have much to say because I haven't been feeling well. I've been having seizures and I'm just very depressed.
We didn't hear you, Tina.
You can't hear me?
No.
Can you hear me now?
Yes.
How about now?
Perfect.
I said, I haven't been feeling well. I've been having seizures and mine have been getting longer. They've been going from 10 to 15 minutes long. So I have not been doing well. So that's why I've been being quiet. I'm sorry.
But have you addressed it to your provider, to your neurologist?
My neurologist upped my medicine. So I keep on top of my medicine. I tell everybody to do the same. And I've actually been on group chats on Facebook. And I've been talking to other people on Facebook. So I'm out there. So if you guys want to get in touch with me, I'm on Facebook. Reach out. I'm okay. I'm taking care of my son tonight. So that's why you've been seeing me get up and move around. And actually, one of the ladies that was on here tonight, I actually told her to come on here tonight.
Well, thank you. Thank you.
So
Well,
one of the ladies who you were talking to tonight.
Good hearing that you are doing fine. I know it's rough when you have a lot of seizures, but if you follow your physician instruction, you probably will do well. And I'm sure you will.
I do. I always follow my physician. So I'm okay, you guys, don't worry.
Thank you everyone again for coming, and thank you for Greenwich for sponsoring us, and thank you Rachel for being on top of everything all the time. And again, thank you very much for everyone who come and participate and have question or share wisdom or educate us and just take their time and be here with us tonight.
I love it here. Thank you.
Yes, thank you all. Thank you, Dr. Kettani and Dr. Benbadis, and thank you, Robin and Greenwich for the sponsorship. Hope you all have a lovely evening and hope to see you next month.
Thank you so much.
Thank you.
Everyone.
Thank you.
Good night, everybody.